I'd like to start by thanking AfA Animals for inviting me to this Connect session and getting the chance to meet so many of you. I'll be giving a very brief introduction to ICAM. I'll be talking about how we perceive the role of CNVR or TNVR or TNR or ABC or whichever term you wish to use. I think we all know what we're talking about here. And then I'll go into monitoring and evaluation. How do we collect data against indicators that matter to us and to governments, with some examples from projects and suggestions for practical and simple methods of measurement. But let me start with a quick introduction to ICAM. So we were first formed in 2006. Our members are all international charities or international specialist groups. You'll see their logos at the top of the slide here. And our mission is to support the development of humane and effective dog and cat population management globally. We publish joint guidance documents. Here is a selection of 3 of those. We run conferences and webinars. If you haven't yet signed up to our 2024 conference, please know that the registration is live and free on our website. It's just 2 hours per day for 5 days from June 17th through to the 21st. So I hope you will join us there. We host free online courses. We have 3 available at the moment. One is a course on how to be a mentor for a multi-stakeholder group that wants to plan and implement DPM, including how to keep them working together as a cohesive group. And then 2 that are on DPM more broadly, one for implementers of DPM and one for policymakers in DPM. And finally, we develop tools. So one example here is Talea, which means count in Latin, which is an app designed for conducting street surveys of free roaming dogs and or cats, which I'm going to mention again later today. I did want to start with a clarification of how we perceive CNVR fitting within the wider dog and cat population management systems. In this diagram, we have a collection of services in green, working together as a system, underpinned by those foundations in blue that support these services to be sustained and used effectively. And you'll see that CNVR isn't called out by name here. We present CNVR as a way to deliver reproduction control. In many communities in Asia, it will be a leading intervention and how the majority of sterilisations are conducted each year. But that's not the case in all countries, and this is a concept of DPM that should work globally. Importantly, CNVR does not stand alone. It's part of this comprehensive system, and that's because population management systems don't just work to influence the breeding of the animals currently on the street, it also has to consider other sources of future street animals and work on those too, so that it's working on causes and not only symptoms. To explore this a little further, this is a visualization of basic dog population dynamics. It shows the different subpopulations of dogs or states, and it also shows processes. So demographic processes are part of population dynamics. They are the way that dogs arrive and leave the population and how they move from one state to another, including birth, death, and movement out of the home, either temporarily in the form of roaming or permanently when lost or abandoned. When we bring in CNVR, what we do is directly impact these processes, the birth rates within the community and unowned dog subpopulations, which is important. Where these are a significant source of the next generation of free roaming dogs, this is impactful on future numbers. It also prevents the suffering and dying of many puppies. But it does not impact those other processes. So if you have plenty of owned animals that are allowed to roam, or unwanted owned animals, including puppies that are abandoned, then your CNVR impact will be blunted. Now, I'm not saying that NGOs should be responsible for implementing all the services required to influence all these processes. Different stakeholders will have different roles and specialities. It's perfectly appropriate for an NGO to lead on an intervention like CNVR, whilst government is working to deliver other services. It's a comprehensive set of services and stakeholders that make up an effective system. So where an NGO is delivering a CNVR project, it's important to point out the role that CNVR will be having, but it's also important to point out what else is left to be done. And what we should not do is claim that we are solving everything with CNVR. It's an important contribution, but we must continue to advocate for the rest. Now, there are two very important additional processes that CNVR can influence, and those are removal from the streets to shelters and culling. CNVR presents a humane alternative to these two stray control measures. I did want to flag up the World Organization for Animal Health, that is WOA's standard on dog population management, which is Chapter 7.7 of their Terrestrial Animal Health Code. Now, this is not legally binding, but the veterinary authorities in 183 countries have signed up to follow WOA standards. So this is still very influential and can be a useful document to lean on when advocating for CNVR. Since May 2022, this chapter has included a clear section on CNVR that states that this is an alternative to removal. It does also state this is not a standalone solution for the reasons I mentioned previously, but this is a strong supporting statement for the use of CNVR. Note they just talk about removal here, by which they mean removal to shelters, but the chapter also does not support the use of culling as an approach to population management. So CNVR is in effect promoted as an alternative to removal for any reason. I'd now like to talk about impact and how monitoring indicators can help us evidence that impact, which we may need to do for many reasons, including to secure government funding or supportive policies for CNVR, to establish public support for our work, and also to help us learn which of our interventions are working and what needs adaptation or improvement. In this ICAM guidance document called Are We Making a Difference?, we describe 8 commonly stated impacts of DPM systems and provide guidance on how to measure them all. But today, recognising that we're focusing on CNVR, I'm going to hone in on these 4. The first step in monitoring and evaluation is to establish which impacts your intervention is aiming to have. Now, that might sound simple, but we often become transfixed on the very hard job of achieving outputs, like the number of dogs or cats we have caught, neutered, vaccinated and returned, or the number of owners reached through a responsible ownership campaign, or children educated through a schools programme, and we forget to look up at the horizon and state what impact we are actually trying to achieve in the long term. What is the change that we want to see? Now, these impacts, changes, goals, aims, again, you can pick any term that you prefer, are often quite broad statements, like improved dog welfare. The job of indicators, also known as metrics or key performance indicators, is to make these impacts measurable. So here is one example of an indicator for each of these impacts. Ideally, you want 2 or 3 indicators for each impact so that you're not relying on just one, and can do what is called triangulation, that is looking at more than one piece of evidence for the same impact. But that's an ideal, not an essential. And key to selecting these indicators is to have a method of measurement that is robust and repeatable. So by definition, this needs to be simple and affordable, because you'll need to keep repeating it. So here are some examples of methods of measurement. We have a street survey coming up for the first 2, which I'll talk through in a moment. For the third, we see a method of measurement that relies on someone else. It's a secondary source of data because someone else, the hospital in this case, is doing the data collection. Our job is to establish regular access to that data, and that will probably require a direct contact with the hospital. The final method is probably the most time consuming, which is a household questionnaire. I'm a big fan of street surveys because they can be really affordable and provide data for several indicators. I think some people are nervous of street surveys because when they're used to calculate an estimate for the dog or cat population size, there are complexities. You need to be careful how you set up your sample and be sure of your subsequent analysis, and there are several options for that analysis, so you do need a bit of experience. But there is a simple option for street surveys. You can establish a convenient route that traverses those areas that you know are hotspots for free roaming dogs or cats, where you'll be focusing your CNVR effort. And then simply repeat a count along that route, ensuring you keep the survey protocol the same, starting at the same time of day, using the same means of transport, avoiding days with unusual weather or events like public holidays, basically trying to ensure that any change in the number of animals that you count on your route is reflecting or indicating a change in the wider population of those animals. I don't have time to go into the details of how you set up a route and what details you might want to record on your survey, but please, if you're interested, and I really hope you are, check out the Talea webinar on this link. In the second presentation of the webinar, you can hear me going into much more detail on how you can set up a survey like this. In that presentation, I am in particular talking about using Talea, which is a free Android phone app designed by ICAM in collaboration with an organisation called the Wise Monkey Foundation. You can sign up for your own Talea project on this page, and you can use the video user guide to get you started with your surveys. I want to share a couple of examples of street survey data. The first is from an organisation called Help in Suffering in Jaipur, India, who run, I guess, the classic ABC intervention, with a focus on sterilisation of female dogs and vaccination of all dogs. And this is one of my favourite examples of street survey data. I like it because of its simplicity, but it also shows their long-term dedication to data collection. So they use 6 routes, which they walk every 6 to 12 months on 6 consecutive mornings, same time of day. And you can see Dr. Sanjay in this photo with his clipboard, and they're actually now using Talea as well. There he is. And what you see on this graph is simply the total number of dogs seen on all of those 6 routes. So it's the total number of dogs seen. And you can see the clear decline in that number over time. And although I don't have the data to show you here, they have continued this counting since 1997, now approaching nearly 30 years. There's no complex analysis here. It's just the number of dogs counted during each survey event on those 6 routes. What makes this so powerful is the dedication to long-term data collection and the consistency. Same routes, same time of day, same survey protocol, year after year. This is a similar example from Bangkok in Thailand. Here we have NGO Soy Dog Foundation. Again, this is CNVR, but they also do provide sterilisation services for owned animals. They use mobile clinics because their working area is really very big. They're doing the greater Bangkok area. So they can't rely on just static facilities. The area is too large. I also wanted to highlight their systematic approach to coverage. They conduct CNVR on all the roaming dogs they can access within the district, ensuring they've exceeded 80% coverage before moving on to the next district, and then returning to the same area on a 1 to 2 year cycle to top the coverage back up above 80%, each time requiring fewer sterilisations to reach that 80%. And computer modelling suggests that this front-loading followed by maintenance approach may be more effective than spreading your sterilisations evenly across time. So you can end up decreasing your population further for the same number of sterilisations if you do this front-loading of effort followed by maintenance. Because their working area is so large, they use 20 routes. Each one is surveyed from a motorbike over a period of 1 to 2 hours by 2 people. They completed this survey at baseline in 2016, and then they started up annual surveys from 2020 onwards. The data on nearly all of these 20 routes has shown a steady decrease in the number of dogs per kilometre of street surveyed over time. And when we look at the average dogs per kilometre of street, we can see this has shown a very significant decline overall. Evidence of a reduction in dog density can be really important for securing government support for CNVR, but an additional step is exploring whether this change is meaningful for citizens, which can be even more influential for elected officials. Soy Dog ran a household questionnaire last year where they approached a random sample of households and asked them a range of questions, both about dog ownership practices and their perception and experience of free-roaming dogs. One question was, how does your experience with free-roaming dogs differ today as compared to 9 years ago, before the CNVR started? Of those people living in areas that have benefited from CNVR, most of them perceive the problems with dogs to be fewer today. And this is dose dependent. The more rounds of CNVR the neighbourhood has received, the more likely the resident was to say the problems had diminished. We got 3 rounds of CNVR up here, then 2, then 1. Whilst people living in areas that had not yet received CNVR, this group down here, were equally likely to say the problems were greater today than they were to say that there were fewer. This can be quite a powerful indicator for a government stakeholder, but the household questionnaires are relatively costly to implement, especially when we consider that we need to repeat them over time. If you're planning on implementing a questionnaire, I recommend Kobo Toolbox as a data collection tool. One alternative to household questionnaires is to try to access data on complaints about dogs or cats to municipalities. One challenge is that this data is not always recorded or accessible, and if it is, they may not be recording it to the level of detail that you need. For example, some complaints are about nuisance or dog bites, but others may be concern for animal welfare or requests for CNVR action. So these are clearly measuring importantly different perceptions of free-roaming animals. So my recommendation is to work with whoever is receiving the complaints to set up a robust system of data capture with clear categories of complaint type and where geographically these complaints are coming from, so you can identify those within your CNVR area compared to those outside your area of working. And do that as soon as possible, ideally before your CNVR project starts, so that you can have a baseline. You can also use street surveys, going back to street surveys here for a moment, to track changes in free roaming animal welfare by scoring every animal you see for their basic welfare state. Now I recommend keeping this simple, so going for a body condition score scale that has only 5 grades, from 1 emaciated through to 5 obese, and leading to an indicator that is the percentage of the population that is in poor body condition, and scoring skin condition just as the presence or absence of a visible skin problem, not going in any more detail than that. With these welfare scores, it really matters that you have good inter-observer reliability. That means all your observers score the animals in the same way, and also good intra-observer reliability, which means that the same observer scores in the same way over time. And to achieve that, you need to invest in observer training and refresher training. To help you achieve this for body condition scoring, ICAM has developed a body condition scoring training set of PowerPoint presentations and a quiz that you can access on our website and use to test your observers. Although I will say that testing people with real animals seen on test or pilot surveys will also be a necessary part of their training. The last indicator I want to talk about today is dog bites. And I think this is an underutilised indicator. It can be really powerful because bites are obviously distressing for citizens, but also bite treatment costs money. So governments are interested if you can show that you have decreased dog bites. This is again data from Helping Suffering in Jaipur. The publication is cited on the bottom left of the slide here. And we can see in this top graph a decline in dog bites over time. And that decline occurred despite an annual increase in the human population of nearly 5%. So you would have expected an increase in dog bites if there had been no CNVR intervention. This decline will be in part due to there being fewer dogs overall because of the CNVR intervention, and in part due to the vaccination leading to fewer rabid dogs. But dogs bite for many reasons, and rabies is only a relatively small proportion of those. So they also looked at the seasonality of the bites and found that the highest bite rates occur shortly after peak whelping season. So the proposed motivation for some of the bites was actually maternal defensive aggression. These were mothers protecting their puppies from a perceived threat. And sterilisation within CNVR was directly taking away that motivation and therefore reducing the bites. I have one more example of this dog bite indicator from Bosnia in Eastern Europe. Dogs Trust Worldwide set up in Bosnia in 2012 and ran a comprehensive DPM project. It included CNVR, but it was not limited to that. They also spent a lot of effort on the owned dog population, including a very effective veterinary training programme and associated marketing campaign, which has created a sustained increase in the owned dog sterilisation levels. There have been a number of impacts of this DPM project, but I wanted to show you this one in particular from Sarajevo, where we have a reduction in dog bites reported by the Emergency Medical Centre in blue. These are definitely not rabies related, as they have very few rabies cases in Bosnia now, but it's strongly correlated with a reduction in the estimated free-roaming dog population in the city, which you see in orange. One point I did want to make about both this data set and the dog bites in Jaipur is that this data comes from just one hospital. This doesn't measure all the dog bites in the city, and that's okay. This is a sample from a representative hospital, in the same way that we do not survey every street on our street survey, but use a route that covers a sample of streets. So long as we believe that our sample is a fair representation of our wider project area, it's not biased in any way, sampling is a reasonable approach to making our monitoring affordable. So in summary, I see CNVR as an incredibly impactful part of both a dog or cat population management system, but it does have to be used alongside other services to be fully effective. We can use robust and repeated methods of measurement to provide data on indicators. Those indicators measure our progress on impacts and can be used to evaluate whether our intervention is working and establish support for its continuation. I've described just 3 methods today. There are many others that you can read about in our Are We Making a Difference guide. So I talked about street surveys, questionnaire data or accessing complaint data, and accessing bite data. In order to decide where to put your measurement effort, I suggest taking time to understand what your government really cares about. Which impact would they be most influenced by if you could show evidence of its progress? Many thanks for your time and attention today. Please take a look at the resources on our ICAM website, including the Telea webinar, and let me know via email if you have any questions. Many thanks.